Good afternoon and welcome to this, our fourth New Hampshire COVID-19 Vaccine Alliance meeting. That's through Zoom. Today's date is January 12th. For those who haven't participated in these Alliance Zoom meetings, our mission is to convene stakeholders across New Hampshire to promote vaccine confidence, support accurate and consistent vaccine messaging, and to foster coordination of the vaccines allocation plan. Second, our goals are really fourfold. One, to promote public buy-in of the vaccines to increase the New Hampshire's immunization rates. Two, and most important, is to act as a force multiplier to support the New Hampshire's COVID-19 vaccine communications and the allocation plans through the Bureau of Infectious Diseases and Control and immunization programs. Third, it's also, and we'll be getting into this as we start to open up to public audiences, is really to help counter misinformation about the COVID vaccines. And fourth, to use New Hampshire's immunization program to promote its use and answer questions in conjunction with the department. Next slide, please. So we have a number of takeaways from our last meeting on the 5th. As you may recall, the governor did a press conference at 3 o'clock that afternoon. So we're going to go through some of those items just as a reminder. One, instruct your phase 1A most and moderate risk to register for the COVID vaccines at the link noted on the web sheet and that we've distributed through a lot of different sources. Two, please schedule your vaccines at one of the 13 fixed sites, unless you're an employee of the hospital and the hospital has said that you're going to get your vaccine there. Third, if you're registered on VAMS and not received a confirmation, there's a couple of things that you can do. One, first, check your email spam filters to ensure that the address up on the screen from vamcdc.gov has not been blocked. If that doesn't work, then please call the New Hampshire COVID Coordinating Office at 603-271-5980. Third thing that we just learned is we will also send your information to us, and what we'll need from you, if you haven't got a confirmation notice, is your full name, your date of birth, your email address, and a phone number. And we'll send that to the department. The department will aggregate that up and we'll try to figure out what's preventing you from getting that confirmation. And finally, if you haven't been able to get your second dose, they're transferring systems at the end of the month. But we understand that the department will be opening up the system to those to schedule through VAMS in the next few days. And so we'll get you information out and we'll talk about it a little bit more as we're moving forward today. Next slide, please. Just some updated information. Any information that is about vaccine distribution in New Hampshire is going to be on the vaccine information site. And there it's at that link. So it's under the general COVID vaccine site for the state, and go to vaccine information or vaccine planning and you'll find that. Under that, you'll see, most importantly, a summary of the new allocation plan that outlines phase 1B and phases 2A, 2B, 3A, and 3B. And that will take us well into the summer through those phases. We anticipate that more details, in particularly any information about the essential workers and how they would fit under these phases will be forthcoming. And we expect to have that guidance a little bit later this month. In particular, I want to draw your attention to HA notice number 33, and that's also on the vaccine site. And that says that all moderate risk healthcare workers and first responders should now be registering on the VAN system to get your first dose of the vaccine. Finally, and we've had a tremendous response by physicians and nurses to this, But if you're interested in volunteering to give the COVID vaccines, and this includes part-time retired nurses, other healthcare workers who can give a vaccination, to register with NH Responds, and that URL is www.nhresponds.org. And then scroll to the COVID teams and complete your information there. There's a lot more information that will be coming from NH Responds once you sign up and as we move to phase 1E. And finally, next slide, please. We have a little background information for those of you or your organizations who have enrolled as a vaccine provider. So we have some suggested interim steps before the phase 1B guidance comes forward. Again, you can go to the vaccine information site through the department that's listed above, and that you'll find information instructions on how to sign up and how to complete the application agreement to move forward. And that agreement is for any group that would be interested in distributing that to the public. And in particular, we'll get into some discussion about possible private groups for large industries a little bit later today. The phase 1B guidance is expected late January. And the department will provide instructions to the public on how to register for and access the vaccines. We're hoping to have a series of conversations before that with those of you who have been involved as partners, so we can give you a little information so you weren't caught like last week where you got a lot of calls from patients asking when can they get the vaccine. So we'll continue to work with the department to get you that information out so you can be prepared for phase 1B. But in preparation for that, we have three kind of steps that we'd suggest. One, please take a hard look at your patient databases and see and aggregate who will fit into phase 1B, as it's currently stated, and phase 2A. That will get you started. It could be, we don't know this, that they may ask some of the sites to outreach to the current patients. We'll get more information on that from the department as 1B guidance, but it's good for you to be able to prepare so you can reinforce those messages to your current patients who fit in one of those two phases. Second, become familiar with the New Hampshire Immunization Information System. And again, there's a section on the department's vaccine information site that will take you in, and you can learn a lot more about how that system works and to register with the department for that, or ask any questions that you might have. So it's an important next step. We believe that the IIS will be used at least for tracking the vaccine as we move forward. So important, if you've signed up to be a provider, that you at least understand the rubrics of that system. Then for our third and finally, we'd say, please plan and figure out how you would be doing the vaccine distribution at your setting. And if you've already done this for the flu vaccine, you're probably largely there. But there are best practices for vaccine distribution that are also on the COVID vaccine information site. Again, go look at those and they can offer some further tips or help you prepare for other things that you need to have in place for doing that efficiently. And the final thing that I'll just mention is information is coming forth right now. It looks like 2 other vaccine makers are going to file for their emergency use authorization at the end of the month, and that is AstraZeneca and Johnson & Johnson. If those come through at the end of the month, as they've been talking about, and if they're successful, then it'll take probably 2 to 3 weeks to get that clearance from the ACIP and the FDA to move forward with that emergency use authorization. And then probably another week or so for them to get their distribution channels linked up and ready for comment. But we anticipate perhaps if everything goes well, there will be additional sources for vaccine in or about March. So just a little information. And the last thing, as you can see up, I just want to thank our sponsors, Harvard Pilgrim, Anthem, Derry Medical Center, Convenient MD, WellSense Health Plans, and New Hampshire Healthy Families. Without this, we couldn't be providing this service, so we thank you. And let's move to our session. This morning, we are pleased to have Laura Montenegro participate in our discussion. Laura is an information officer for the New Hampshire Division of Public Health Services. She's going to begin to kind of give you a broad outline of the communications plans underway by the department to help aid the promotion of the vaccine moving forward. Laura?
Thank you. Thank you for inviting me and having me come here to talk a little bit about what we're doing on our side and how we can better assist with communication on all of your side. We take our job very seriously and we work really hard. So, we're interested. We've never done this before. So as a group, we're all interested in the best way possible to communicate. So, so just to give you all an idea of what we're doing here at the Division of Public Health Services, we're a group of about 8, and I say 8-ish on here because we all have other duties as well besides planning for communications around vaccines. So we wear many hats and we juggle, but the team is works really hard, as I said, and we're trying to do the very best we possibly can. And so our current responsibilities, and there's more, I just, I drafted this quickly so that you can get an idea of how we work, is we have the COVID vaccine inbox. If you're not familiar, it's COVID vaccine at dhhs.nh.gov. I can give you that link. I'll put it in the chat in a little bit.
Hey, Jim, while we're waiting, this is Vanessa Stafford with the New Hampshire Hospital Association. I did notice a question that came up in the chat that circles back to your brief update about how the notifications would be coming through to providers from DHHS.
Right, that's a great question. The short answer is we don't know. We're speculating on how they're doing it. It'll probably be a multiple phase kind of modality is our speculation at this time, but that will come through in the phase 1B guidance. And we've requested through the division that we be able to kind of give this information to you in advance of it going to the public presentation, literally through the governor's office. We completely understand that last week when it was the afternoon of the 5th, when this was information that various offices, practices, urgent care centers got overwhelmed with calls from patients saying, when can I go sign up? So we're going to try to work with the department to get this information to you as quickly as we can in advance of that guidance going out to the public so that you're prepared for whatever role the state is going to ask you. Hope that's helpful.
Yes, I think the only follow-up question was specific to second dose scheduling.
Yeah.
Second dose scheduling, again, just captured it. We're switching system away from the VAM system on February 1, and the division will be contacting those directly on how they can get their second dose in February. Go ahead, Laura, knock us out.
I'm sorry, I'm having trouble with this. Let's see, here we go. We're back in the slideshow. Maybe it's working.
And then just go to display settings up at the top in the middle, pull that down, and then swap presenter view and slideshow.
There we go. Okay.
Thank you.
All right, thanks. Challenges of Zoom. Yeah, so those are really good questions, and actually I'm going to get to them here. But so basically, we have a slew of responsibilities that we're working on and developing plans that are they're very fluid because we don't know, we don't necessarily know all the answers right now. And as most of you know, or all of you know, that we just solidified phase 1B last Tuesday. So we're just, we work to get the information out as best we can when that comes up. So internal communications, partner communications, that's where you all come in. It's worked really wonderfully. And I think, Jim, I think you can attest to this, but, our communication system of having Jim sort of be the middleman and to be able to take your questions and then transfer them to us and vice versa has been really helpful on our part so that we're not inundated with, more questions than we already have. I can give you an idea. The COVID vaccine inbox, we get about 400 inquiries a day right now, so it's a lot. And we are getting more team members. There's a call center that's going to help out with some of those inquiries that are the more of like the where do I fit when there's answers that they can be directed to. But it has been a challenge up until now, and that plan hasn't yet come into effect. It has to do with email addresses, but I won't bore you with those details. So if you have emailed the COVID vaccine inbox and you haven't received a personal reply, there is an auto response that goes out to everybody, but you should at some point soon receive a personal reply. That is our ultimate goal, that everybody gets an additional response, even if it is already in the auto response, just so that they know that there's a human on the other side, but that it's a lot. So that is that's our biggest challenge right now as a group, just to get that under control. But I believe once the 211 call center is up and running, then we'll be able to focus on other things as well. More pressing to getting messaging out to the general public and whatnot. So okay. So yeah, we have some. I just shot some themes over here of questions that we're getting, or issues or challenges. Vaccine confidence is obviously one of them. This right underneath, this is a sticker that we designed. I have not gotten an update yet, but I believe it should be in by the end of this week or next week. We ordered 500,000. So we haven't completely just thought about that process of how we're going to distribute it, but we will be distributing them. They come in rolls of 100, and you're welcome to take them and give them to your patients. And we're hoping that will fuel the social media buzz about, everybody's taking a picture like what people do when they vote. So the V here is for vaccine, and the rest is pretty self-explanatory. This is also our hashtag that we have already started using, the Vaccinate NH. We've used it for other campaigns, but we're strictly using it for COVID at this point, just to promote, again, the confidence among social media users and getting people to follow and get vaccinated. So other common themes are, when is it my turn? And we know that as I said before, last Tuesday, our plan for 1B was finalized, as was pretty much the general guidelines for the other phases, which was different for some people based on our draft plan that was issued in October. So that is a communication hurdle for us. And so any way that you all providers can help reiterate the fact that we're the hierarchy of I shouldn't say hierarchy. The prioritization is those who are at most risk for death or serious illness from COVID-19. So individual risk factors beyond, the 1A groups, which are healthcare providers and first responders. So, and then what's an mRNA vaccine, or what's in mRNA? We've heard everything from microchips, different things. So trying to get out I have proof from our one of the graphic designers that we work with. It just talks about, it doesn't say this is not an mRNA, but it says, you know, what is an mRNA vaccine and why it's safe. And then again, disinformation, misinformation, depending on what it is. Some people just don't know, and then other people are deliberately pushing out wrong information. So, and as Jim mentioned earlier, this is, I think, everybody's best resource. The unfortunate thing is there's a lot of information on it. So this is our COVID vaccine resource page for vaccine information. There's tons of information. So, you know, we're doing our job, or trying to do our job of pulling out the things that are important to message out to the public from here. There's, you know, loads of frequently asked questions, as I'm sure you're all aware, of different questions regarding vaccine. So a lot of, you know, going back to the COVID vaccine inboxes, a lot of the questions can be answered with information here, but I get why this is like a daunting task to get through this all. So, you know, we try and break it down as much as we can in little pieces. I just wanted to show one of our latest infographics if you haven't seen it, and you're more than welcome to use it and share it. That just talks about the different phases pretty clearly. So so yeah, if you don't have it, I'm happy to send it to you, and to help, you know, people understand where they may fit in. And then I put another page for different issues and challenges. Jim had talked about this before, which I'm very grateful. There's a couple things happening with VAMS, as he explained. Some people are getting the no confirmation email, sorry, they're not getting a confirmation email rather. And so one of the ways that also works, and I don't know, Jim, if you would be willing to do this, but for some other groups that we're working with, they email, like, so everybody would send to you, I didn't get my confirmation, and then you would send them all to me, and I would do it via email. I would get those. So in one of the other groups, they do a spreadsheet and they put everybody's name and then what the issue was, and then I send it to our staff here that works with VAMS, and they go in and they check everybody, and they'll say, yep, you're registered. No, you put in, you know, an A in your name and you don't have an A, so, you know, you need to go back and re-register. So that might be another way that would be helpful, and could get, you know, everybody the information that they need as soon as possible. So we're looking about a 1-day turnaround time for those spreadsheets.
We'll be happy to do that. Thank you. Great
yes.
idea.
So, and then you had also mentioned this. I just want to clarify the February dates should be open today. Today is the earliest. I'm told the very latest is the end of this week. So for those of you who can't schedule your second dose in February, you won't have to wait until the end of January. It will be open soon. I know that they're working out a couple things. So again, the earliest is today, like sometime today, and then the latest they've told me was Friday. So
can you walk our viewers kind of through how is that going to come from a message from the division, or is it coming through VAMS again?
So what we've been telling other people who have been asking is just keep trying. I don't think it'll come through VAMS. I don't think that they're planning on issuing a second. That's a good question. I'm not quite sure, but I can always communicate with you, Jim, and then if you want to communicate it out when I'm sure that it's up and running.
That would be perfect. Yeah, I think that's been a big question for how are they going to be recontacted to come back into VAMS, or a secondary system to schedule that second dose?
Yeah, I'm not quite sure, and I would say probably not. I would say probably not. So probably I need to communicate to you, and then you can get it out to everybody that February is now open.
Perfect.
Okay.
Thank you.
And then, as I explained before, other issues are prioritization and information sharing, because everything is changing so much, and we are a state agency, so a lot of things need time to get approved. You know, I know it can feel like we're lacking, but you know, this is a helpful session for me as well, so that we can know more what you all are thinking, and as far as what you feel like you need to be messaged to more. Um, and I guess I don't think I have any. Oh, this is, yeah. So this is part of our. Oh, I'm glad sorry, I forgot about this page. So we have a communications plan, an internal communications plan, and part of that includes this a toolkit for external partners. So it is in the works, and the drafting of the toolkit was more for when we are ready for general vaccine for the public. So that's still in the process, but we will have a toolkit which will be we'll be able to provide to everybody who wants it, and then you can share the messaging on there. So instead of just doing, oh, here's the message we just made, here you go, you'll actually have it all in one toolkit, like for social media, and depending on flyers and things like that that you can then print out and provide to your patients. So and I think this is just some of the elements that are on our list. And we're working with different groups to really focus on, again, especially when we get to that general vaccine group, to focus on what the best methods of communication will be. So we are looking at these different social media channels, whether WhatsApp is a good one. It's one that a lot of minorities use, so that is a way that we thought we could communicate as well. So we're researching all of these and figuring out the best way so that we can put our resources towards reaching out in different ways. That makes sense.
Well, Laura, that's terrific. That is a lot of questions. I know one of the questions that we've gotten repeatedly over the last couple of weeks is about PSAs, and I know some stakeholders are interested in either working with the division or developing their own PSAs and or content. So to the extent that you become comfortable with getting that information out, we'd be happy to help distribute that, get that out to everyone. The second area that we kind of hear about, and this is from employers and clergy and some other local leaders, is maybe developing an influencer toolkit. I think the CDC has the rubrics of one, but the idea would be, how can they use their channels as an employer or clergy member? How can they help be a positive force? What other materials can we help put into their hands to help promote vaccine confidence? So that's something else I think we could do. Actually, some of the specific clergy groups were saying if we had templates that we could take and that were in Word and develop them more on a ecumenical message. They're very interested in doing that, so they can have their clergy members talk in their own vernacular to their congregations about the vaccine.
Yeah, I think certainly, and Jim, we can talk more about that. Maybe just you and me. The PSAs, I know there's at least a couple in the works right now that I know of. One is with Dr. Ben Chan, and I don't know I haven't gotten an update on where it is in production, but I know there's a couple radio PSAs and then at least one television PSA. So, I'll share with the group when I have more information about that so that it can be shared widely.
Perfect. That's terrific. Yeah, I think the other thing is, what would be the best advice if a particular organization or group wants to develop something or is developing something? Maybe it's a radio spot or PSA or something. How can they best coordinate with you, and how can we kind of help coordinate some of these messages getting out?
Yeah, I think that's a really good question. And what we do offer that. So our public information office and Jim, they can go through you or they can reach out directly to me if they want wording checked or like their script, we're happy to do that. And we have done that in the past, particularly for organizations that have sent out press releases. We're more than welcome to look over that as well to make sure that the information is accurate.
Great. And I'm just going to hit a couple of questions here. Just to kind of restate, if you have healthcare workers or first responders in the most risk or moderate risk categories, and they've already tried to get on and haven't got a confirmation message, send us, if you can send me their name and their email address, probably a telephone number, just in case, the best telephone number to reach them. And we'll gather those up and make sure we get them to Laura and she can get them to the VAMS team.
I think one additional thing, if they can, is well, two. One would be date of birth, and then the other is so I occasionally there's other issues besides no confirmation email. So if they could, give us just a short, no confirmation or whatever it may be is the issue, so that we can make sure that the team that's looking into that isn't wasting their time, looking at something that's already been addressed. So. Yeah. So
looking for name, full name, date of birth, email, and phone number.
Yeah, that's great.
Anything
else?
I guess it's the messages are, do you have a sense of when B is going to get out, and when will some of the practices or those who have signed provider agreements, when will they have this information so they can kind of prepare? We mentioned kind of last week, they all got surprised in a lot of phone calls. So I think that's do you have any sense about when, they're going to get this, or before the public messages, when that might happen, or it's still too up in the air right now?
Wait, sorry, repeat the question, Jim.
So I guess they want to know when information is coming out and when the vaccine will be sent to offices. So how will that information go out to all those who have signed provider agreements? Can you give us any insights into how information is going to go out in advance of the 1B announcements, and when you think that they'll be receiving vaccine?
That is something that I'm not quite sure on. I do know that there's still a lot of conversation about that, how it's going to be operationalized. So they are working on it, and when, again, using you, Jim, as a liaison for that group is really helpful, so that we can get the message out fast when it comes in. I know that it's probably not the answer that people want, but and especially when everybody's trying to plan, how do I do this, but so we're still on par to wrap up 1A by the end of the month. So I'm hoping that within the next week or so we'll have a stronger foundation of how we're operationalizing the distribution of vaccine.
Right. Well, TW Hall has kind of committed to come back to us next week. And I'm sure, hopefully we'll have some more information, so we can kind of start going a little bit down into some of those distribution issues through the 1B allocation as we move over. Let me see what else. It says national info today to vaccinate over 65.
So,
well, go ahead.
So that is, that's a prime example of, how our left foot doesn't always know what our right foot is doing, and how we're flying. We keep saying we're building the plane as we're flying it. We get hit with, different things, which is, it is what it is. But so the answer is we have our health experts looking at it right now, and I would expect a statement or something shortly from the department. So
right. Yeah, I will just mention early last week, the State Disaster Medical Advisory Committee met and reviewed kind of the what I would call what is going to be the kind of philosophy for the remaining stages. And the question that was really asked is, are we trying to prevent infections, or are we trying to prevent deaths? The SDMAC is made up of about 25 experts, ethicists, physicians, nurses, other leaders. And the message that came back pretty consistent from this advisory group was that we really want to focus on deaths in the earlier phases. So I think that's where you're seeing there's not specificity right now on essential employees that you'll see like on the CDC document. And that kind of level, as you saw in the kind of the 1A guidance, usually will come out with the kind of the sub guidance. So if there's going to be anything on that, that's probably the guidance that we would see a little bit more information, as well as when we're moving into 2A, but that hasn't been specified. What you've seen is really the stratification that was announced by the governor last week was really on risk base through the initial phases. And so I think that's, what the initial guidance would be, and then hopefully, more will be teased out in some of the specific guidances for the sub phases.
Yeah, we do expect, and I think it's been delayed just a minute, but probably by the end of this week, the technical assistant document to accompany the 1B group. So, as we have on our website, we have the 1A group, and you have the whole document that goes into all the nuances. We'll have that for 1B probably by the end of the week.
Perfect. Yeah, and I would fully expect, again, that's probably what TW will begin to present on next week at this meeting, so we can kind of have you get some more information in advance. So I would expect if you have your practices have those who are actually involved in the implementation, next week's meeting is probably when you'll likely want to get involved and hear have that information. Do we have any more questions kind of coming through? If you have any questions, please share them in the Q&A area or the chat area.
Jim, there's a number of questions. I'm not sure if you just want me to start at the top. We might have had Laura answer a few, but I know that there's specific questions about vaccine distribution and logistics.
Okay.
So starting up at the top, Stephanie had wanted to know if either yourself, but it's probably a question for Jim, given his background, if you could clarify moderate versus low risk 1A staff. They're a small clinic. Staff would arguably be defined as low risk based on role. However, they have some frequent patient contact.
Right. The short answer, and thanks, I was looking at the wrong area.
That's okay.
In the chat box. 1A, the most risk is any practitioner who has direct patient contact or limited or occasional contact. Now we're getting into, if you go into the phase 1A guidance that was issued on the 24th, that's probably your best source. You'll see a listing of practices, and it also has non-clinical roles that are part of the moderate. The low risk is fairly small, but you'll see that there's, as I recall, and I'm doing this off my memory, it's everything from staff that you might have involved who are doing logistics, truck drivers, food handlers, other things like that, are those who are in the moderate risk category. But take a look at that 1A guidance. Again, that's on the vaccine information page. And about halfway through that guidance, you'll see a whole list of practices. I know just from contact from some of those professional groups, some of those groups are already have registered for the first dose and are beginning to receive those. So there's a little bit of blurring between the various tiers. But look at those. If you have any questions, then please email me directly or call me, and we'd be happy to try to help you work through that. But it's pretty well defined. And again, it's really for anyone who has any healthcare worker or a first responder that has some kind of either direct, limited, or occasional contact with patients.
Yeah, I'm just gonna put the technical assistance document in the question. I think I did it. Maybe I didn't. But yeah, so it's saying the lowest is food and retail without patient contact, other non-clinical without patient. So it really depends on your, your mode of patient contact, how much you have administrative. So if you're, for example, if you're a food server and you do have some patient contact, you'd fit into that moderate group. Administrative, clerical, and financial, again, if you're talking to patients, you would be in that moderate group rather than the lowest group of those who don't maybe work in the back that don't have any patient contact. And then computing and IT, those individuals who wouldn't have patient contact that maybe don't work in the office or they work in a separate area.
Right. And it's so we kind of read these out when I was tap dancing last time, but it's audiologists, chiropractors, clinical lab techs, dental and ophthalmologic lab techs, essentially any kind of technician, dietitians, nutritionists, massage therapists, occupational health and safety specialists, opticians, dispensers, optometrists, physical therapists, assistants, aides, podiatrists, psychologists, social workers, barbers, hairdressers, hairstylists, and cosmetologists. So that's probably someone who has it, and we'll reach out to those groups to make sure that they understand that they're in that particular group. It also, as Laura mentioned, it gets into food retail for those settings. And then the non-clinical workers, again, anywhere in this group is listed childcare workers in hospital, couriers or messages, dispatchers, drivers, again, maintenance and repair workers. So everyone who's connected to a healthcare facility, that definition is pretty broad, should be thinking about signing up at this particular time. So let's try to take on a couple more questions. Who will be allowed to administer the vaccines under phase one? The short answer, it will be those hospitals who are doing it and prepared to do it. Two, it will be at least the 13 sites. I know there's some decisions, some issues that whether that changes and how that changes. But it will also open up to anyone who signs one of the provider groups we talked about. So that's primary care office, actually can be any kind of physician office, healthcare office. It can be who can administer the vaccine, if that's within their scope of practice. It'll also be urgent care settings. It can be pharmacies. We have actually gotten some outreach from some large businesses who are interested in having either to vaccinate their employees or possibly opening up a public site on their campus. So we've gotten some of those inquiries. What we've done is encourage these groups, even these business groups, to essentially complete that provider agreement so that the department knows that you're interested in doing something like that. Did I miss anybody, Laura? Okay.
No, I think, yeah, fixed sites, hospitals, and those who register through the provider agreement, but also have the storage capacity. So I think that's going to be, that will also be a challenge, particularly with the Pfizer vaccine.
Yeah, there's a question about those in retail settings, and I'm guessing this is would be outside the 1A. How are they going to be communicated to? And I think that will be similar to how the rest of the general public is. And again, our guess is it's going to be multimodal on how that information gets out to those groups. But right now, I just want to emphasize it's really, we're still within 1A. So it's just for the most risk group and the moderate risk group right now. I hope that that's a little bit helpful, but there's information we don't know at this time. My guess is probably within the next week or two, the department, or we can help arrange something with those who have signed those agreements to get some more specific information so they can prepare adequately for the beginning of February. But I would kind of draw you back. There's some interim steps on it. They're common sense. Look at your patient groups, see who would fit into those so that you could communicate to those if you were asked to do that. And also look on the immunization information website. Pretty sure that that is going to be used for at least tracking. So you and your IT staff and your clinical staff will want to be familiar with the IIS. And the third thing is think through, and there's various materials on the vaccine information site of how you can prepare and what are the best practices for being a vaccine distribution site. So look through those. I think those things are kind of the key right now, interim steps that you can do. And then as we get closer to the pronouncement for 1B, we'll try to set up a forum for those who have those agreements. So you can ask lots of questions and we can get you some specific information prior to the public announcement for 1B. Okay, we have some, when will the vaccine dashboard be operational, which will show the number of vaccinations, locations, and other demographic information?
I don't have a great timeline on that, and I apologize. I will reach out during this meeting to see if I can get any additional information. I know that it's being worked on. I know that it's frustrating to not have, and I concur. I join you in that. So I can tell you we release once a week, and it's on it will be on Fridays as of now, but when we had the New Year and Christmas, I think it was on a Thursday or Wednesday perhaps. So if you go back to the update page on the DHHS website, the COVID-19 website, the daily updates that we issue, and you can also get on that list so that you can receive them. So on Fridays, we give an update of all the vaccination, where they've been, and who's vaccinated. That's our workaround for right now. I know it's not perfect, and we certainly agree with you that we need a dashboard to provide this information in more real time, but that's what we have now. So the latest one is on the, I guess Friday was what, the 8th of January. So, I can send that link in here too, and you can see that's the latest update that we have.
Great. Okay, we have a non-communications question here, but just in case I get it wrong, you'll help me here. It's from Dr. Gladstone. Will physicians signing up to help with the vaccine distribution be offered the vaccine sooner than they otherwise will be eligible? From what I've talked with Dr. Chan is if you sign up through Response and you're going to be working, then you would be essentially fit into 1A. You would have direct contact with patients. If you sign up, then there would probably be some kind of mechanism for you to get the vaccine prior to vaccinating others, because you would be exposed to them. So I think that's how that definition is working right now. Again, as we get closer to phase 1B, that'll be a great question for, and we'll try to work with NH Response on how they're going to handle vaccine distribution to volunteers who would essentially be exposed to patients. The second is there are hints to speed up immunization rates. The vaccines will be offered to everyone over 65. How soon will that happen in New Hampshire? Well, the summary that was sent out on the afternoon of the 5th, essentially in phase 1B, that will be individuals 75 and over. And that's expected to be probably phase 1B is February into March. And then phase 2 is essentially those 65 and older. And that will begin probably sometime in March through May to complete both phase A and 2B. We don't get down to phase 2 starts is 50. 2B is 50 to on up. And so again, the likelihood is we're going kind of from a risk basis is most of those 65 and over will start in March, and then in 2B sometime probably April or so, maybe May, we'll be going into the phase B, which is 50 and above. And I hope that's helpful. Here's a question maybe you can answer, Laura. This is more kind of operations question. Will the department start a date for a Coos County fixed site?
Yeah, so Coos County, it's a really good question. And actually one I asked the operations people this morning on our meeting. I asked the very same question, and what I've been told is they've narrowed it down to where they would like the site to be. And I asked them to keep me informed, just because we have, like, I've had questions from the public and first responders. We are fairly confident it is in Berlin. So I think that might be helpful, because I know that was a big, I think people were driving to Littleton. So, but I can't provide any more information than that, but I know that they've almost settled on the actual site. So hopefully it'll be up and running soon. And, it takes almost, not a whole lot of time for them to stand up these sites. So I guess that's the good news. But I'll let you know, Jim, when I know, so that you can hopefully articulate that to your
Perfect.
group.
The question is, will you be using VAMs in phase 1B and going forward, or will you curtail the use of VAMs at the end of January?
So from what I can understand, and I'm not totally clear, I'm not the expert on this. So the VAM system is going to be replaced by a system that doesn't have the A in it. So it's VMS. So I believe, from what I can understand, again, I'll send out more information to you, Jim, when I can. And TW is a better one on this, as he's chief of all of operations. But so if you had scheduled for your first vaccination through VAMS, you will still schedule your second vaccination through VAMS. If you are scheduling your first vaccination for February 1st or out, it will be through that VMS system and not VAMS.
Right. There's a question here about why is there a clog in the pipeline of the vaccine? Why are we not doing maybe as good as other states? And I have looked at that information by state and from various areas where it's being distributed, whether it's hospitals. It appears, and I think the governor commented on this a couple weeks ago, that the rollout of the federal program to long-term care facilities, that's through CVS and Walmart, that had a bit of a bumpy start, a slow start. And I think it's beginning to catch up now. But if you look at the data, that's where, probably we haven't got the quick start that we wanted to. And that is a pretty good share of the current vaccine right now. So I think they're up and running, and they're making more progress in that particular area. But overall, the data suggests that in New England, we're doing as good as anybody right now, and that we're on par with our neighbors, Vermont and Maine. Every state is having, little glitches in certain areas where, they're maybe not doing as best as they thought they could. But that's clearly where we head. It's really in the long-term care facility, which is a separate arrangement. It was arranged by the federal government with those two pharmacies. So again, New Hampshire has only so much control of those, and I think that both the department and the governor have been trying to do everything in their power to speed them up. And there's the distribution link that I think Laura just suggested. Again, you can take your own analysis of it right now, but that's kind of my take from it right now. Let's see. Are you seeing anything that we haven't addressed here, Vanessa, that I'm missing? And I apologize.
There's a question about assuring that those in 1B get equal access.
Right, thank you. Yeah, I think that's an issue that Dr. Beth Daly had took on, that they do have, that is being incorporated into their distribution plans, and they are looking at that closely as part of the 1B rollout. We have had communications with the Disability Rights Center, and we'll work with specific, and you'll see in 1B, it specifically notes those with intellectual and developmental disabilities. So that will be named. Also, there is and I think Dr. Chen has described this as being the exception, not the rule, but they have a list under the summary of underlying medical conditions that's adapted from the CDC. And so if you present in 1B with 2 or more of those conditions, however, essentially the state is giving physicians some discretion here. That'll probably, we're hoping for a little bit more guidance on that as we move into 1B, and I'm sure there will be. But it's in part, I would say, it's professional integrity to kind of say, you know, this fits the position, or there are conditions that are equivalent to that. So I think what the department is intending to do is, it's not going to be ironclad. If you don't have this specific disorder or 2 of these conditions, then you can't be in part of 1B. I think that exception is, and I'm sure there'll be more guidance on how you essentially, probably a physician is going to have to attest to a patient that, you know, they fit the broad definition that was intended for that category. But we're hoping that in 1B that there'll be more discussions, and I'm sure we'll get into a lot more discussions. But I think what the department and the governor do is provide some flexibility in these definitions as we're moving forward.
Yeah, that's correct. I just wrote back to somebody in the chat with the same. The EVIs are working on and other public health staff are working on how to really operationalize that, so it's not too much of a heavy burden on anybody. I think that's probably the goal. It's, you know, so it's not like this massive heavy lift that you know, every provider is having to endure, but that we have, you know, a little bit more strict parameters around what that looks like. So I know it's in progress. I feel like I'm saying that a lot today.
Great. I'm going to look back over in the chat box here. Again, in the chat box, you'll see from Laura the comparison in the distribution, link to the latest vaccine information as we're moving. And I'm just trying to see if there's any more information. Again, if you have any more questions, we're kind of wrapping up, coming up on the hour, so we can take 1 or 2 more questions. Vanessa, if I missed something.
There is one that Laura can probably answer about the state provided pharmacy doses and whether or not they're being reported to either the state or federal registries. I believe both, but I'll have you confirm.
Sorry, the state provided, I think
Pharmacy
both.
doses.
Yes, both.
Perfect, thank you.
Great.
And the other one in the chat is, are individuals going to be required to get vaccinated in the region that they live? No, currently right now, I mean, if you go on the vaccination, you put in if you're trying to get, vaccinated at a fixed site, where you live. But if something's not open in the day you want, you can drive further. So it'll be something like that when it's for regular distribution for the general public.
Yeah, and the other thing we would just remind again, this is all phase 1B, is you'll also see sites for hospitals. And again, if you're not an employee, you haven't been told to get your vaccination there, then don't. Choose one of the public sites, please. Otherwise, what happens is eventually you'll get a message back saying, no, we're not allowing you to get your vaccine here. So again, if you're in 1A, and you're not directly been told by your hospital that you're going to get the vaccine there, then please register with one of the fixed state sites. Great.
And I'm just going to close circling back on Laura's point about getting vaccinated in the region that you live. One of the questions, if helpful, that came up to our organization, our association, from our hospital members was whether or not we have a lot of patients that cross over lines. They live in Vermont and Maine, but they seek their care in New Hampshire at our facilities. And so there was a question relative to the guidance that would be provided on providing the vaccine to patients that live out of state but get care in New Hampshire. And so I think, and Laura, correct me if I'm wrong, but I know that DHHS is currently working with the surrounding New England states on pulling together that guidance so that it's standard across the states. And I believe the recommendation is going to be that regardless of where you seek your care, that you receive the vaccination within your own state. And so that's the guidance that I believe we're going to be moving forward with, but more to come on that.
Yeah, and that's what I've heard as well. Again, things change all the time, but yeah, that's what I've heard as well.
Yes.
Well, terrific. I'm just going to do a quick kind of wrap up here. One, Laura, thank you very much for joining us today. We really do appreciate really good information. And next week, we're planning to have TW Hall back to talk a little bit more about the allocation plan as it's moving towards a 1B. Laura, at some point, we would love to have you back, maybe as we walk into the public phases, so we can talk a little bit more on exchange ideas or you get feedback on some of the ways that these various groups can help engage. And our stakeholders will, I know, will actually begin to change too as we move into more public audiences. I think we'll have more of those consumer, clergy, and other type of employer groups that will probably be coming on to these discussions and asking questions. A couple of things. If you're a member of the Business and Industry Association, they, for any employer groups, they are holding on Thursday at 11 o'clock. They're holding a similar kind of webinar with Dr. Chan, Dr. Talbot, and myself to kind of go through information. And again, that's more kind of a business, but that's another opportunity for you to get some more information. Just want to go back for one of the key issues that was raised. If you're not getting a confirmation through the VAM system, please send me, and I just listed my email address. Please send me those practitioners who fit into 1A, most or moderate risk. Send me their name, date of birth, email, and phone, and we'll make sure we get that list to Laura and the department so you can follow up specifically on those. I already have a short list, so that's a great. And then Laura indicated that second doses, that specific guidance and how that's going to happen, that should be available sometime tomorrow. We'll get that information out to all of you and through multiple channels once that's available. So with that, again, next week with TW Hall, thank you for your time. We're a little bit over, but we look forward to this continued discussion. And thanks again to Laura for your time and your efforts on behalf of Granite Staters.
You're welcome. Thank you very much. Thanks for having me. I appreciate it.
Carol.